Assalamu alaikum. This is Mohammed Alayed, internal medicine resident in King Faisal Specialist Hospital in Riyadh. And today I'll be discussing our study in the prevalence and outcome of active and latent tuberculosis among patients with inflammatory bowel disease in an endemic region under the supervision of Dr. Badr al-Bawardi. So, a TB infection remains a significant concern, especially among patients with inflammatory bowel disease, as they may require advanced therapy that may suppress their immune system.
Mohammed, move the slides with the green button. Huh?
So screening for tuberculosis infection is critical for patients with inflammatory bowel disease before initiating advanced therapy. And the rates of TB infection, they vary geographically. However, we have a limited data in the management of TB infection, inflammatory bowel disease in our region, which is considered endemic. So our study aimed to study the prevalence, the risk factors, and the outcomes of tuberculosis infection among inflammatory bowel disease patients. It was a single-center retrospective study from the time period between 2011 to 2024, in a patient with a confirmed IBD diagnosis at King Faisal Specialist Hospital. We included the patients more than 14 years of old with a confirmed IBD diagnosis, either clinically, histologic, and radiological findings, for at least 6 months follow-up. In all patients who underwent at least one interferon gamma release assay test. The definition of latent TB was having a positive interferon gamma release result with no clinical or radiological evidence of active TB. So in our study, we included a total of 424 patients with a male predominance of 58.7, and the majority were having a Crohn's disease with a percentage of an 81.1%, and ulcerative colitis with a 17%. The interferon gamma test resulted negative for 91.5% for our patients, and a positive for 3.5%, and an indeterminate result in almost 5%. The rate of latent TB infection were around 4%, and the active TB infection were around 1%. Moving to the baseline characteristics of our patients in comparison between active and latent TB patients and negative TB infection patients, the only significant difference between them is the rate of the extraintestinal manifestation, where it was more prevalent in the active and latent TB group. So moving to our therapy, so in latent TB, we had a total of 16 patients. 5 of them were on infliximab and 2 were on adalimumab. And we used other therapies such as vedolizumab, upada, mesalamine, ustekinumab, gizolcumab, and azathioprine. And the latent TB treatment was completed in 75% of our patients, and there was no evidence of TB activation with a median follow-up of around 58 months. The second group, with the active TB group, there were 4 patients in our study. The therapies used, one of the patients was on infliximab and azathioprine, and the other patient was on adalimumab. 2 patients on adalimumab, and the third patient was on adalimumab and azathioprine. Active TB therapy were held, and it was resumed after, and there was no evidence of reactivation with a median follow-up of 58.5 months. So in a conclusion, latent TB infection observed in around 4%, and active TB were around 1% in IBD patients, and temporary cessation of advanced therapy did not result in TB reactivation. However, larger studies are needed to further clarify risks of TB infection in treated IBD patients. Thank you.